Some people recovering from COVID-19 still feeling the effects weeks and in some cases months after they tested positive. A new study says that more patients are experiencing long hauler symptoms than we originally thought. Here's what some of those patients told NBC News.
I've had a fever almost every day since March 25th.
I got so bad where I had to go to the emergency room. The chest pains just came out of nowhere. They were very severe. When I went down the stairs, by the time I got to the bottom of my stairs, I could not breathe.
I've had a lot of neurological symptoms, tremors, essential tremors, a really pervasive memory loss / brain fog. I've had kind of dysexecutive functioning, general cognitive dysfunction. It's been really hard to find words for things and sometimes understand what other people are saying.
Another night of insomnia, which is one thing that has changed since COVID. I had insomnia before COVID, but it seems to have gone up another level.
I have to get on a nebulizer machine every single day, like a severe chronic asthma or COPD patient. And I'm actually on COPD medication. I tested positive for 2.5 months straight and do not have an antibody. I'm on steroids to further notice. I've never had issues before. I went back to work about 2 weeks ago. I'm only strong enough to do 4 hours. My purse is full of medication. I can't go nowhere with medication, inhalers, steroids, everywhere now. Everywhere. I have stuff in my car, in my purse, on my desk at work. Everywhere that I frequent, I have a thing full of medication. Because I have to make sure if for some reason I get shortness of breath and can't breathe, that I won't collapse on anybody. That's my new normal. I'm 38. I'm healthy. Never, ever, ever. Barely caught a cold.
Today I feel like hot garbage. Really tired, but also headache, dizzy. Fever is 100.8. Stomachache today. I had a bout of diarrhea for no reason. It's 2 days until my birthday, and I've been sick for 112 days, which is like 3.5 months.
I don't think the severity of what long COVID is anywhere near understood, but it is a significant and pervasive problem. This is not just like you curl up with Netflix and, hang out for a couple of weeks. This is just like extremely painful. It changes your sense of self. It changes your relationship to other people. It transforms your life. It is a disability. It is, physically and emotionally traumatic.
We call the COVID long haulers. And to my other long haulers out there, I love you. I'm praying for all of you. You're not alone, because we feel alone because we don't have no one to understand. People look at me. I look normal, but I'm not. I'm not okay.
NBC News medical reporter Erica Edwards joins me now. And Erica, you just want to cry for all of those so-called long haulers, all that they're dealing with. Nearly 100 symptoms could fall into that long hauler category. What are people most commonly dealing with here?
Yeah, so you're talking about a survey that included more than 1,500 of these so-called long haulers. They're patients who'd had symptoms for weeks and months on end after their diagnosis. They did the survey that they did was in a support group on Facebook. The most common symptoms weren't really all that surprising. They're ones that you and I have talked about before on the show, Allison. They included headache, thinking and memory issues, fatigue, fevers and cough. However, the survey revealed dozens more symptoms, actually 98 symptoms in all. They included vision problems, sleep disturbances, dizziness, joint pain, even heartburn. Now, it's not clear whether all of these symptoms were directly related to their COVID-19 infection. Some people were saying that they had anxiety or sadness. And of course, that's what a lot of people are feeling during pandemic and lockdown. So, regardless, these patients are insisting that these symptoms occurred after their COVID-19 diagnosis that popped up. And so, still doctors really aren't sure what symptoms are related to the infection, but overall, they are feeling a lot of different things. And it's, time that we are, paying attention to these symptoms. Allison.
Erica, does the CDC recognize all of these long-lasting symptoms, or are some of them not really on their official list, if you will, just yet?
Yeah, right now, no. Actually, the CDC only lists 11 symptoms that could be associated with COVID-19. However, last week, the CDC finally did acknowledge these folks in a report finding that at least a third of the COVID-19 patients in their study had long-lasting symptoms that could linger for at least 2 to 3 weeks after their diagnosis. And other renowned medical institutions, physicians are also recognizing this group of people. In fact, today, Anthony Fauci on the MSNBC said, he addressed the long haulers, saying that we're starting to see that they do not recover as completely and as quickly as you would like. How long does it take you to get back to normal, he asked. That's an open question. We're only 6 months into the outbreak. Allison.
Erica, I have to ask, because we're curious about the name. Where did the term long hauler come from?
Yeah, isn't that funny? So it comes from a woman named Amy Watson. She lives in Portland, Oregon. She created a COVID-19 patient support group called Long Haul COVID Fighters. The name, she said, was inspired by the hat she threw on the day she went in for her COVID-19 test back in April. And she told me today, she said, I hadn't washed my hair in like 3 days. It was gross. I just threw the hat on. The group is named after actually her trucker hat that you just saw right there. And the nickname stuck. And now it's used by many doctors and organizations who identify with the long haulers. And I talked to her today and I said, I asked her about all these other people who are using that term. And I said, gosh, you should really trademark this, Amy. And she said, you know what? She doesn't want to make any profit off of this name. She's just happy the word is getting out about these people who are experiencing these long-term symptoms and are finally getting the attention that they deserve. Allison.
Oh, come on, Amy. Trademark it, put it on a trucker hat, and donate the money to charity. I think it's fantastic. I know it's a nickname that nobody wants, but it is certainly creative and something to smile about hearing how it started.
Yeah, you're right. You're right.
Another record-breaking day in Florida. 217 people have died of the coronavirus there in just the past 24 hours, and more young COVID-19 patients are now going to the hospital. NBC News correspondent Carrie Sanders joins me now from Fort Lauderdale. And Carrie, the positivity rate for kids in Martin County, if I'm correct, is now over 25%. What's going on with young people in the state?
Well, it's certainly disturbing to parents when they hear about these statistics. First of all, the record number of deaths, and then to hear that there are increasing numbers of kids who are testing positive. And as you pointed out, take a look at the statistics. Martin County, where 25%, actually just slightly more than 25%, are testing positive. Suwannee County, 21%. Okeechobee County, 21%. We've heard a lot about Miami-Dade County. 1 in 5 kids, almost 1 in 5. Are testing positive. And of course, this is of greatest concern as everybody's talking about going back to school. Miami-Dade schools decided within the last hour that they are going to do strictly online learning. It is the 4th largest school district in the country now deciding that they're going to go online learning. And the sort of statistics we're looking at definitely played a role in the decision to say kids aren't coming to school, they're going to learn through the computer. Allison?
Carrie, sticking with this school theme here, Governor DeSantis said today schools can delay their start dates by a couple of weeks if they need to. What else is he saying?
Well, interestingly, he has once again repeated that he does not believe that kids are necessarily some group that is of great concern. In fact, he says the kids rarely come down with it. But when you look at the national statistics, you can see that at least 75 children have died, and many of those children did not have underlying conditions, or more importantly, to consider if they did have underlying conditions, nobody knew it. Their parents, their doctors, they did not know it. It was only after they got coronavirus and after they sadly died that it was revealed that they had an underlying condition. And anybody who has small children knows that very often you don't find out about these underlying conditions until there's a crisis. Coronavirus is not the crisis anybody wants to learn under. Allison?
Absolutely not. Carrie, given all of this, how worried are parents, and are some of them changing their plans for the upcoming school year?
Well, they are. You know, so many parents were toying with the idea, okay, if school's going to be open, maybe I'll send my child, maybe I'll keep my child home. Then there are some who've decided that what they're going to do instead is just to do homeschooling. That's different than online schooling. That's where the parents are involved in getting homeschooling set up, generally working with an accredited partner online to have that sort of homeschooling. And to give you an idea, it's estimated 6 million more kids are likely to do homeschooling this year than in years past. I had a chance to speak to one parent about making that decision, Yvette Garcia, deciding that she's going to do this for her 5-year-old son, Julian. This is what she had to say.
Because I'm not a trained professional, I'm not a teacher, I am worried, I'm concerned. It's something different. It's something my family has never dealt with. You know, we've always gone to public school or an institution. So this is different, but, you know, just take it day by day and just learn from it. If we have to do it for an extended amount of time, then, you know, we'll perfect it.
Yeah. And that really goes to the heart of the issue that parents are realizing when it comes to education, their roles this coming year, no matter where they are in the country, are going to have a greater participation. And it's all pretty much new territory for everybody because the normal approach is now so different, Allison.
Oh, Carrie, I am so impressed with all of the parents across the country who are spending their days not just parenting, but teaching as well. Another question for you about what's going on in Florida. Of course, we have the situation with the coronavirus, but it is now hurricane season, and storms are forming in the Atlantic. Obviously, a big concern in Florida. How are people there preparing for that as well?
Well, right now, Floridians are just beginning to pay attention to the Eastern Caribbean, where there is an unnamed disturbance. It's nothing more than a disturbance right now. Nobody's given it a name. It's certainly not a tropical storm or a hurricane, even though there are some tropical storm warnings up in Puerto Rico. But by Saturday, it's possible that that weather system will make its way over the island of Hispaniola, over Cuba, both mountainous areas that might break it up, but nonetheless it's going to make its way to Florida. And right now, from the East Coast to the West Coast in the state of Florida, everybody's being told, pay attention. And of course, paying close attention are the hospitals, including the hospitals here in Broward County, where they have an abundance of patients. In fact, many of the patients who had been initially going to the hospitals in Miami-Dade are now coming over the border into Broward County, causing the hospitals at Memorial Health System, for instance, to take conference rooms and auditoriums and convert those into areas where they can treat the patients. And the doctors, once again, telling everybody, including the nurses, pay close attention.
Have your hurricane preparedness plan in place and make those plans early so that you can assure that whatever your plans are, you're taking into account the fact that we are also deep in a pandemic, which is highly contagious and extraordinarily dangerous.
I can't think of anything worse, Allison, than a pandemic with a weather system like a hurricane colliding at the same time when everybody's supposed to be social distancing. It is the nightmare scenario. But at this point, again, we need to stress, Floridians are watching the Eastern Caribbean closely, but at this point, there is not, I underline, not a named storm. There is not a hurricane. But of course, you have to watch the weather because Mother Nature has a tendency of catching people off guard. That's why they're saying, please stay alert.
Yeah, Floridians know that well. They sure have a lot to be worrying about and watching for right now. Carrie Sanders, thank you so much. Coronavirus cases are skyrocketing in California's Central Valley. NBC News correspondent Steve Patterson joining me now. And Steve, what is going on there? What kinds of numbers are they seeing in the Central Valley?
You know, the coronavirus is just raging out of control in the Central Valley. And that is not to say that it is still not a huge problem in L.A. County, still seeing well over 2,400 cases on a 7-day average here, still hospitalization rate up here as well. But in the Central Valley, things have really exploded. It is truly where the thrust of the virus is. It is kind of the tip of the spear of COVID. You're seeing, whereas the state has about a 7.5 positivity rate over 7 days, in the Central Valley, those 8 counties, it's anywhere from about 10.7 to 17.7, so close to 18% in some of those counties. The hospitalization rates per capita are higher. The number of cases are higher, and they're starting to see the death rate start to explode there as well. One of the problems is it's obviously known as kind of the breadbasket of the country. So much agriculture, so much as far as meat processing plants are there. It's where a lot of the agriculture comes, not only for the state, but really just everywhere across the nation. That means there's a high amount of essential workers, as we've been seeing across the country. Essential workers are often a high percentage minority. Here in California, that means the Latinx community has been disproportionately affected. They make up about 39% of all Californians, but they make up about 56% of all COVID cases, 46% of all COVID-related deaths. Those workers, they travel together, they're working in cramped conditions on the farm, they come home, and they're in tight quarters with multi-generational households. So the virus just has a prime candidate to sort of spread, attach onto, and devastate those communities, and that's exactly what it's doing right now. Allison.
So Steve, what is the state doing to help people there?
So there was this $500 million federal relief package for the state of California. The governor the other day said, literally, he's got a laser-like focus on the Central Valley. He's allocating $52 million from that federal package to that area. Specifically, it will go to 3 things. It will go to education for the workers, specifically about safety violations, because a lot of them are afraid to speak up when something happens. This will educate them that you have rights. You can say something if there's a problem. The second is it will go to testing. Testing, obviously, poor in areas in which you have a high percentage of minorities. We've seen it in the Black community and, of course, here in the Latino community in California. And then thirdly, it will go to help isolate patients that are sick. They've found that the hospitals there don't have the proper isolation wards to really stop the spread when it is worse, and especially when it is ripping through some of those communities as it is now. It will also mean the allocation of what the governor has described as a strike team, a federal strike team that will be on the ground assisting those testing sites, specifically assisting those frontline healthcare workers that are dealing with the virus, as really the epicenter of the whole thing has shifted to that area. Allison.
So, Steve, what kind of reaction are you getting from people? What are they saying? Comments on how the governor is doing and handling their situation? What are they telling you?
There's been a high amount of criticism, as you might imagine. I think people are happy that the focus has shifted, that the governor has said that he's making it his sole focus at this point, because that is where things are the worst. And he's made it seem like this is where my attention is going to be over the next few weeks. But a lot of people are saying, you know what, too little, too late. We've had systemic problems in this area for years before the virus started. And then when it did start, we should have seen this coming. One of those people is the California Farm Worker Foundation. He is the executive director. I spoke to him over Zoom last night. He basically said the same thing, that he was happy that the focus is there, but he feels like this is coming a little bit too deep into this crisis. Here's specifically what he said. We have him on tape. Listen to this.
Governor Newsom from the beginning should have taken into consideration the marginalized communities that have been disproportionately affected by COVID and invested in their well-being, and so that therefore we don't have the numbers that we have today.
To be fair to the governor, there was a similar situation that happened closer to the beginning of the crisis in Imperial County, California. That's on the Mexico border. The cases there were out of control at one point, and then he implemented much the same sort of things, and the case count went down by 60%. So it seemed to have been effective there. Everybody, obviously, all across California is hoping that it will be as effective in this case as well. But you're talking about a much bigger scale, these 8 counties that make up the Central Valley. Allison.
All right, Steve Patterson in California with the Central Valley is having a rough go of it. Thank you so much. One person every 6 minutes. That's how many Texans are dying from the coronavirus, according to a USA Today analysis. And that's where President Trump is today. But he's not there to address the pandemic. NBC News correspondent Morgan Chesky is in Midland, Texas. And Morgan, what is then the focus of the president's trip today?
Hey, Allison, the focus of the president's trip today was really two parts: encouragement for the industry in this area, which, as you can see behind me, is pretty much oil and gas, and that is it. And also, it was to fundraise. The president landed here in Midland earlier today, then his motorcade rolled to Odessa, about 20 miles down the road. And that's where the president had an exclusive luncheon, if you will, with a $2,800 buy-in just to have a plate. If you wanted to take a picture with the president, that would be $50,000. And if you wanted to sit at an exclusive round table with him, well, that would cost you $100,000. Now, the goal was to raise $7 million, try to stoke the campaign war chest as we wind down now just under 100 days to the election. And then following that ceremony, we do know that the president was taken to an oil rig for a brief tour, and then he made remarks for about 15 to 20 minutes to several hundred people there, where he essentially tried to separate himself from Joe Biden, specifically, of course, when it comes to energy policy, invoking the name of Alexandria Ocasio-Cortez and saying that her Green New Deal was endorsed by Biden when he hasn't explicitly necessarily done so, but essentially drawing a line between himself and potential Democratic leadership in the White House, saying that the future of Texas energy lies in him staying in power for another 4 years. And so that was really the gist of what we heard from the president today, Allison, here, saying that, you know, should you want to continue with the success that Texas oil has had, where, albeit we are in a crash right now, but if you go back just a year ago, 1 in every 3 barrels of oil coming from the U.S. came from this area. The president stressing, if you want that to continue, let me continue to lead. And so it was obviously a warm reception. We do know that as far as Texas being talked about as a potential battleground state, Allison, that could potentially be the case, but at least here in this part of the state, he was elected, 75% of the voters here voted Republican back in 2016, whereas the rest of the state, that number sat at just 52%. So the president very much playing to his base here on this visit that was short, relatively speaking. He flew in at around 11:30, 11:45 this morning, and he's anticipated to fly out here in just a short time. Allison?
Morgan, we know the pandemic, as you've been saying, has really slammed the oil industry in Texas. Can you talk to us about how it's affecting folks there?
Yeah, well, the pandemic's had a unique impact here in West Texas, Allison, for a couple reasons, in that the industry here was already hurting from a price war that was happening between Saudi Arabia and Russia, who had driven the price down, and in doing so forced a lot of businesses to go into massive layoffs or shut down completely. Now, you add a pandemic to that and the fact that a lot of businesses had to shutter whenever that shutdown went into place back during the spring, and you have people that really where money was not a concern at all, now waiting in line at food banks. We know that unemployment has really soared over the past year in particular, going from 2% in neighboring Odessa to 13%. So right now, the people that I spoke to here say that what they wanted to hear from the president more than anything wasn't so much virus related, but it was just bringing the industry back because it's been, you know, hurt from the crash number one, but then add a pandemic to that. And they find themselves really hurting. As far as numbers go in this part of the state, they don't fare as bad as what we've seen, particularly in the southern part of Texas, in the Rio Grande Valley. But it's still an incredible concern. We spoke to someone on staff at a nearby hospital that said, due to the virus's impact, up to 20 personnel, members of the team, doctors, nurses, were unable to work. And so that just leaves everyone else shorthanded, especially the patients who need that help the most. Allison?
Morgan, do we get a sense if the president adequately addressed those concerns today, or addressed them at all for that matter?
You know, everyone I spoke to, they've been through this before as far as an industry standpoint goes. And so they did want to hear the president offer some encouraging words. He did promise to try to incentivize private investment into the industry. He did promise to sign some measures and put them in action, rather, that would kind of expedite the business towards getting back to normal. But really today, you know, people have to watch and wait, both with the pandemic and with the industry. And so for the fans of the president that came out to hear him today, or that were paying attention to his visit, it was an encouraging sign. But really, it remains to be seen if there is a light at the end of the tunnel here for a lot of these people. Allison?
All right, Morgan Chesky in Midland, Texas. Thank you so much.
Thank you.